right, so good afternoon, ladies and gentlemen. My name is Aisha, and today I'll be presenting to you about assessing first-year pharmacy students and also faculty perceptions on objective structured clinical examinations. So for the remainder of the presentation, I will refer to objective structured clinical examinations as OSCEs. So in case you wonder what that means, it's just a shortened version, because as you can tell, it's a bit of a mouthful. So with our pharmacy school, we have an accrediting body called ACPE, and they actually recommend that we include OSCEs in our program to help assess clinical knowledge of pharmacy students. So we have never implemented anything like this on our campus, so this was our first time doing this, and so we use the first-year students as guinea pigs. We hypothesized that at least 70% of the students would pass this OSCE. And pretty much you might be wondering, what is an OSCE? How does that work? Well, a lot of medical schools do this already. And pretty much it's like a real world approach where you'll have like maybe a real life patient or maybe just actors and students. It's an examination to assess students' clinical knowledge, and it's a bit more hands-on. So what we did for this research is that we had one little area where students had to interact with a patient, and these were just actors that came in, and they had to measure like their blood pressure. So in the first year, in the first semester, students are taught how to measure blood pressure and whatnot. So with this OSCE, we tried to look at that and see how well they did with that, and at the same time kind of assess a little bit of their clinical knowledge that they've been taught in class. So they had 2 different blood pressure related cases, and they had to interact with the actors that we had who played as patients. So at the beginning, before they went in for their OSCE, they had to complete a survey. So our goal was to link the pre and the post surveys. So these were both Likert scale surveys, and in order to be able to connect the 2 surveys, we had to have a unique identifier. And the unique identifier was they had to use the first 2 letters of their high school that they went to, followed by the last 4 digits of their cell phone number, or any number. And they had to remember that identifier for their post survey so that we could link them and see if there was any change in perceptions, whether it was a positive or negative change or no change at all regarding OSCEs. So overall, we looked at the median total score. This is an example of their surveys right here. I apologize with how small it is, but as you can tell, they are scaled surveys. So 5 was strongly agree and 1 being strongly disagree. So usually if a survey had a higher score, overall score, it meant that there was a more positive perception of the OSCE. So the median change in the total survey score was looked upon, and we did a statistical test on that to determine if there was a change in perceptions. So the statistical test that we did use is called the Wilcoxon signed rank. One of the reasons why we did use this test is because this is ordinal data, so it's scaled data, and this is an appropriate statistical test to use for such data. And moreover, it's dependent information because we were linking the 2 surveys. They weren't independent. So the Wilcoxon signed rank test was what we used, and 76 students in total took the OSCE, and we actually had 79% pass. So it was higher than our hypothesis. So 21.1% didn't pass. However, they did undergo remediation and they ultimately passed, which was really good. In total, out of the 76 students, we had 74 complete both the pre and the post surveys. The median total score for the pre-survey was about 97. The post-survey score was 105. And we did, with the Wilcoxon signed rank test right here, our p-value was less than 0.01, showing that there was pretty much showing that it was a good result and it was statistically significant, which was awesome. We were so glad to see those numbers. Furthermore, I have charts here, and again, I apologize because the writing is too small, but sometimes images are a great way to show some information. So if you look here in this section right here, we have just some student perceptions. And before the OSCE, we were asking students, do you believe that an OSCE will measure, your application of clinical skills in pharmacy practice? And as you can see, it increased after the OSCE. So a lot more students agreed that this was a great measure of their clinical skills. And then we also asked students if they felt that it would evaluate their knowledge of what they've been taught. And as you can see, that increased after they completed the OSCE as well. Oh, by the way, red means that they strongly agree or agree. Orange means that they were just neutral, and yellow means that they disagreed. And then in this pie chart right here, we asked if they felt that it was more stressful than written examinations. And as you can see, a majority of them did agree it was a bit more stressful than writing a written examination. Probably more so to the fact that this is not something they were used to. It was something that was different. And sometimes when you're doing things hands-on in a real-world approach, it can be a bit nerve-wracking. A lot of the students I talked to after the OSCE, they were all like, oh, that was so scary. Oh my God, I felt like I was not prepared for that. They didn't really know what to expect. So hopefully, with time, as we keep implementing something like this, maybe students' perceptions on it might change in regards to that. But some students did say it was fun. They actually enjoyed it. So that was great. Then we also looked at faculty. Now, I just want to mention that faculty surveys were not linked. They weren't like the exact same surveys. They were different, so we couldn't link the faculty surveys, but we were able to link the student surveys. So we weren't able to do a Wilcoxon sign rank statistical test on the faculty, but we did look at the total median score of the pre-survey and the post-survey with faculty. And with faculty, you can see in this pie chart right here, we asked the faculty if they thought that an OSCE should be part of the assessment program. And as you can see, their opinions on that changed after the OSCE. 100% agreed that it should be part of the assessment program. And then also, we asked faculty if we thought that OSCEs will be effective in looking at a student's competencies. And as you can see, 100% of the faculty after the OSCE agreed, so which was really good. Overall, that turned out to be successful. I just want to mention that this all happened within a one-day period. So students came in the morning, they sat in a room, they filled out the surveys, they used their unique identifier. Then they went upstairs, they did their blood pressure station, and then afterwards, they went into a room and completed the post-survey, just regarding their opinions on this. So this was all within a one-day period. It turned out really great. The results were good. There was no incentive to complete the surveys. I think they all were just willing to do it. And I believe that is it. So overall, our conclusion was more than 70% of students did pass the OSCE, which agreed with our hypothesis, which was awesome. And student and faculty perceptions of the OSCE overall were quite favorable. And we do feel that it's very important to incorporate this in the program. Just having a real-world experience, being a third-year pharmacy student is golden. Any type of experience really helps. It's different when you're just in the classroom and a teacher is telling you, oh, you need to know this and that. It's nice to be able to use what you know and put it, in a real world situation. So overall, I believe that is it. That concludes my presentation. I'd like to open the floor to any questions.
How many faculty participated in the study?
Good question. I believe we had, I'm not sure if I put it here. I believe we had at least 10 faculty that completed the survey, but I didn't put the results up here of how many completed, but I know it was at least 10. Okay. Yeah.
And with them, what was describe their involvement in terms of, now the students of course did a pre-survey and you you analyzed the results or collected the data.
Yeah.
Before and after, but for faculty, did they go through the same survey or assessment or? Was there-
Yeah, so the faculty, they had a different survey. So this one was the student survey right here, and this one was the faculty one. So obviously their questions are a bit more different. The faculty had theirs way prior to when the students completed their pre-survey. And then after the whole OSCE day, they evaluated faculty's perceptions afterwards, how they thought, the whole process went. And there's a lot more questions. There's a lot more data that I have. Like, you obviously can't fit all of it into the poster. But yeah, they assessed faculty's perceptions, just how the whole process went, and they felt it was smooth, if they felt it was, helpful to the students, and so on and so forth.
And I noticed that you mentioned that the N for students was like 76, which I think I remember as a typical first-year pharmacy class.
Yeah.
So was that like, which year was that?
That was the first year.
Okay.
Yeah.
Which 2014, 2015? 2017?
They are gonna be 2020,
Okay.
I believe. Yeah, they're class of 2020.
Okay.
Mm-hmm. Any other questions?
So for the OSCE, were the students put in front of the entire class, or was it a one-on-one counseling session?
It was a one-on-one counseling session. They didn't have to do it in front of the whole class, which probably would have made it even more stressful if they had to do that. But no, this was more one-on-one. I think it was just really nerve-wracking to them because they haven't done anything like this before.
Did they feel like it was helpful to show their knowledge or anything like that compared to the state version?
Yeah, a lot of them felt it was, although it was nerve-wracking for them, a lot of them did agree that, this was a good way for me to utilize the knowledge that I've been taught and put it to good use.
And the professors too, or?
The professors agreed. They felt that this was a great way to measure students' competencies, especially, for instance, with measuring blood pressure. Yeah. Dr. Nornu?
Your hypotheses, it says 70% pass. So what did you do to ensure that 70% of the people that took the OSCE passed it? You see what I'm saying? So that you can test that hypothesis.
Okay.
Because the title says you're assessing their perceptions.
Mm-hmm.
So that really doesn't have to, what does that have to do with the 70% of the students passing?
So this was just we wanted to add a bit more to the research, and we wanted to see, what was the passing rate as well. We wanted to include that. I also forgot to mention in the hypotheses that we did feel that overall we hypothesized that majority of students might find it favorable in the end after they did it.
Yeah, that makes better sense.
Mhm.
That's what you said you were going to do in the hypothesis, is that
Yeah.
after the experience, they would have a better perception than before. So that's a hypothesis, and you can test that.
Exactly.
But if you didn't do anything to make sure that 70% of the people pass, then you have nothing to really test.
Yes, I
See what I'm
understand.
saying?
Yeah.
So,
Yes.
Were you part of the OSCE? You were. So,
Yeah.
no, she didn't take the OSCE.
I didn't take the
This
OSCE,
is
no.
what we
You didn't?
want.
Yeah.
Oh, okay.
Yeah.
Okay. But were you involved in the process at all? Shepherding kids or students, or were you at all involved in that day's activity?
I was only involved in informing the students about the identifier number
Okay.
because I really wanted to make sure they got that, like they truly understood that, because I really needed to link both surveys.
Yeah.
So in the beginning, before they took the pre-survey, I let them know that it's really important that you include the first 2 letters of your high school, followed by the last 4 digits of your cell phone or whatever number, and that they should remember that identifier for the post-survey they're going to take afterwards. So that was pretty much my role, just kind of informing them in the beginning.
I
And-
got it.
Mhm.
So 70% passed, but then out of those who didn't pass, what happened?
So they underwent
And
remediation.
then how many of those passed?
All of them passed afterwards.
So would it, one thing, it struck me, it's a little bit outside the scope of your particular poster, but I was involved that day just bringing students up and down. And the way it was done was like, oh my God, this is so serious.
Yeah.
And I felt like, lighten up, man, you're all gonna survive this thing. I wonder if students knew that at the beginning, listen, people get through this. If you don't, the bottom line, if you don't
Yeah.
And you know, I wonder if that would, what's your opinion as a student, you know?
I don't think that was emphasized as much to them,
Mhm.
so that might have
Right.
contributed to
Yeah, I
them.
think they really felt like this was a
Yes.
high stakes, man, we're out of
Yes.
school.
So I that was a limitation.
Yeah.
I feel that we should have, in the beginning, just let them know that, this is
Right.
something that we're trying out that's a bit new.
Yeah.
Don't stress too much
Yeah.
about it, but do
Right.
the best that you can. You've
Okay.
already been taught how to measure blood pressure. You guys have had communication. You know how to
Yeah.
interact with a patient.
Yeah.
So just utilize what you know. I feel that probably would have helped with
Sure.
their nerves a bit in the beginning. So yeah, that was definitely a limitation. Any other questions? Yes, sir.
Quick one. So for the actual exercise itself, there was a grade that was part of the course grades?
It wasn't necessarily part of their course grade. It was, I don't think the grade that they got was implemented in a specific course, but I think it was just overall to assess how well they did with measuring blood pressure and interacting with the patient. Yes, but I can get back to you on that because I'm not sure if it was actually implemented in a
I can
course.
answer that question.
Okay.
The OSCEs are, these type of exams are meant to assess skills that can't ordinarily be assessed in a course.
Right.
So they're standalone assessments. And
But
we,
I mean, there's a contingency.
yeah, we plan to implement it in the first, second, and third year. We're still in the development stages, yeah.
Oh, yeah, it makes sense.
Yeah, so that's, actually, with the disciplines that are practicing, that
Yeah.
practice, like
Mhm.
doctors, nurses, pharmacists, you need those type of skills to be assessed one way or the other. So that's the direction of the.
And one thing I also want to note is I'd like to say thank you to Palm Beach Atlantic for giving us the grants to be able to present this. We presented this at a National American College of Clinical Pharmacy conference. It's a really big conference. We presented in Hollywood, Florida, and a lot of faculty from other schools came by the poster and they loved it. They loved to see that there was favorable perceptions from students and faculty, and so they were very interested from the results in our poster. And yeah, so I just wanted to say thank you for that grant. Is there any other questions?
I'm just sure you have plans to continue, given that you said it was a
Yes.
standard for ACPE.
Yes, so we're gonna, this was our first time doing this, so it was, it was rocky at first, but there's a lot of stuff we learned from this, and now we're gonna, whatever limitations we had, we're gonna improve that for the next set of students, and this is gonna be continued further, so maybe there'll be another student next year who will be in my shoes right now, who will be presenting this with a bit more information and data and more. Yes.
It's my understanding that the students were sort of sequestered, and then as they were brought into rooms, then they weren't allowed to see the group that they left behind, right?
Yeah.
So those in the room didn't know if the other one made it out alive, right? So maybe something they could
Yeah.
go back is at least have them walk by the room and wave, so that they're reassured that, like you were saying,
It's not a one way.
it's not a one, yeah, right. Something, we're gonna see you in an hour, guys.
But they were trying to be careful, wasn't it, that they wouldn't spill the
Well,
beans.
right. That's fine.
Yes.
That's
Yeah,
fine.
right.
Yes.
But I got you, you're right, those little things matter.
So yeah, I feel like overall it was really good to do this because, we're trying to, as a university, we're trying to make our pharmacy students the best, when they go out there and practice to help these patients. It ultimately comes down to the patients. And I feel like this is a great opportunity for us to really use what we're taught and, be the best pharmacists that we can be. Yes.
May I suggest that if you haven't graduated by the time the next round happens,
Mm-hmm.
that maybe we could get you to talk to the class of students that's about to do it for the first time, and maybe even the ones that are doing it the second time. And just
Okay.
maybe even share some of these results to some extent and say, everybody survived this. and that might,
Yes.
and to also show that a student,
Mm-hmm.
a fellow student, peer, finds value in this.
Yes.
And just suggesting.
You know, one
It's a
other,
good suggestion.
one other thing,
Mhm.
I'm wondering, and don't jump on me for this, but I wonder how much it would take away from the experience to let them know what the OSCE's about. So we don't have to have all this big deal secrecy stuff.
What do you mean?
So
the
tell
question
me,
is?
you're gonna be asked this and that, and
Oh.
see how you do in terms of really answering the question, you know? In other words, right now, we have to go through all this rigmarole, and you can imagine how hard that is. To have 75 students and no chance of one telling the other what the point, what the OSCE is all about. That's hard to do, and then you have to change it every year. So if they just knew what the OSCE was gonna be about, you're gonna be asked about what, you know, how you pick a topical antibiotic. You know, I'm just saying, because it's in the practice, I think, that the real OSCE part of it comes out.
So maybe
I agree.
So just let them know the general topic is something like that.
I agree. When I was approached with this, I had to do my research. I didn't know what an OSCE was.
Yeah.
But yeah, I agree with you. It's definitely good to inform students just so they're a bit more aware about it. Mm-hmm.
I have a question, right?
Yeah.
It's not based on this because I didn't hear your presentation, I'm sorry.
Oh, no problem.
I came from a different school where we start the IPP, is that right? IPP in the fall of the first year.
Okay.
And here we start in second year,
For the
Yes.
spring of the first.
Spring,
spring of the
first year. Yeah.
Okay. Looking at starting early, the IPP, where students get a chance to go into pharmacy and other places, will make any difference to?
So if I'm understanding your question, do you feel that having the IPPE early on helps them with this
Yeah,
in particular?
go by.
I feel that it's really important to at least get some experience in our first year. Personally, for us, we had it in our spring semester. We had it actually we actually had to finish our hours during the year. So on top of classes, we still had to do our hours, which was kind of stressful. I feel like it's better when it's during the summer, personally. But any type of experience, any type of situation where you're able to interact with real life people, not professors, sorry professors, but you know, yes, like real life patients and such, well, it's helpful. I think experience period is golden. Reason why we have a whole year of rotations, any type of experience is golden.
A lot of students got internships from that P1 year rotation as well.
Yeah. All right, thank you so much.